So the next question is, mm, yes, 6-month patient post tooth multiple pulse sulfur granules. We are just gram positive rods, actinomyces. No, this is microbiology. Gram positive rods. Rods are gram positive, gram negative, cocci and bacilli. These are bacilli. Now either Clostridium is cocci, diphtheria, actinomyces, bacillus. What among these three? So actinomyces was there, gram positive is actinomyces, sulfur granules. It was regarding all these are gram positive, bacillus, Clostridium perfringens, and diphtheria. A, B, C, D. This question, gram positive rods, A, B, C, D, actinomyces, bacillus, Clostridium, diphtheria. Very good. Teeth extracted patient develops ipsilateral numbness of the gum, cheek, lower limb. Which nerve is so? Teeth extracted. Patient develops numbness of the gum, chin, and lower limb. Which nerve is traversing through the body of mandible is responsible? Inferior lingual mental nerve, marginal mandibular branch. Is it mental or marginal mandibular? So A is inferior alveolar and there is C is mental. Now there are two nerves important. C is mental. Let us see, this is going like this. Inferior alveolar is going inside mandibular foramen, it is coming out mental foramen, then it forms the mental foramen. So answer is C, mental. Patient undergo colonoscopy under conscious sedation. In what patient is unresponsive and nurse inform you that the respiratory rate is slow. He is sleeping despite dark room, pupils are constricted. So fentanyl when given, patient has got this type of unilateral buttock claudication, causative vessel. Now there is buttock, common iliac into external iliac. So common iliac may be supplying buttock muscles are supplying. Gardner Thornprick in the arm, photo given of red color streaks surrounding cellulitis, lymphadenopathy, 2 days, causative organisms of aureus or pyogens. Now these are sporothics. Sporothics is commonly known as Rose Gardner's disease, fungal infection. It most commonly affects the cutaneous tissue through direct inoculation when the skin is punctured by the plant material. This is sporothics. Next, cause of discitis, Staph aureus, 6 months to 4 years, Kingila. Young athletic patient with single rib fracture and pain but vitals are stable. Patient is young, single rib, stable vital, analgesia and discharge. Patient attending with a falling of payment of the pub. He admits that he has drunk but never happened before. It is unclear. He is not sure. He lost consciousness. Not. He lives alone. He has small cut on the eye. Now what will you do? This is patient discharge and advice when to come. Admit for observation or discharge. CT scan within 1 hour. He is admitting he was drunk and never happened before. It is unclear. He is not sure if lost consciousness or not. Small cut on the eye. Otherwise normal examination. Observation or CT scan. So there are different opinions. C, CT scan within 1 hour. Maybe A, discharge with advice to come back. A and C, and admit for observation, no one is telling. So this patient needs admission. So this is about NICE guidelines. CT scan criteria within 1 hour, less than 12 GCS on arrival, 2 hours suspected fracture, you have to do. So this is not in the case. 9 8 hours coagulopathy, dangerous mechanism, you have to do. Children less than 16 years, suspected non-accidental injury, post-traumatic seizures, GCS less than 14, suspected skull fracture. So CT scan. Observe 4 hour if one of the following risk. Anticoagulants, consider CT for the patients or anticoagulants including DOACs or antiplatelets. Scan within 8 hours or within a period, so they have to be admitted. Tranexamic acid, use GCS, all this. Cervical spine, CT spine if GCS less than intubated on the children. Admission criteria: admit if imaging shows clinically important abnormality. GCS post imaging, persistent concern, complete imaging, coexisting disease, intoxication, suspicion of non-accidental injury. Discharge criteria: baseline normal if done, no clinical concerns, supervision at home arranged. Pediatric patient less than 5, imaging recommendation gold standard for avoid. Always consider non-accidental injury under children. So what was the answer here? Patient needs admission or discharge, that is still confused. So patient admit for observation, discharge with advice. Old patient needs observation. He drunken but never happened before. It's unclear, he is not sure if he lost consciousness or not. Okay, next question. What would prompt you to do urgent CT scanning under NICE guidelines? A single episode of vomiting, GCS 14, retroarticular hematoma. In which patient? This is important. Single in adult. More than one vomiting, retroarticular hematoma. This is battle sign. This more important, battle sign and all that. Actually, GCS, it has to be an admission therapy. Presented with a nystagmus ataxia, where is the cause of bleeding? This is nystagmus spica. Blockage in middle cerebral artery. What is presenting symptom? Middle cerebral. Upper abdominal muscles, contralateral lower face numbness, loss of hearing, ipsilateral upper arm, sensor loss. Contralateral has to be there. Lower face and contralateral hemiparesis, sensor loss of upper extremity and lower face. Contralateral hemianopia. So next question is, what is the cause of vasoconstriction on efferent? What is the cause of vasoconstriction on efferent? Afferent and efferent vasoconstriction, angiotensin 2. Patient with groin swelling, what is found? Groin swelling, mast cell, sequestrum, fibrous wall, fibroblast. Drug user, false aneurysm. Senescence is due to same as senescence of the cancer cell is due to telomerase P mutation. Senescence means death, old cancer cells getting old. Oncogenic enhancement, antioxidant. Telomerase mutation, so they are getting old. 65-year-old man complains of being thirsty and getting up in the middle of the night to get toilet and random blood glucose 11.5. What is diabetes mellitus? Patient presents with heel laceration at the elbow and loss of thenar muscle action. Patient presents with heel laceration at the elbow with loss of thenar muscle. Laceration of elbow, thenar. Hypothenar, thenar. Which nerve? Median. Which nerve? Median nerve. Which nerve is median to median nerve? Ulnar nerve. What is this? Which nerve me? Okay, median is the first nerve. Complement C3 is secreted from hepatocytes. Lymphatic drainage of glans penis is deep peroneal, deep inguinal. D. Body of the uterus. Body of the uterus. Internal. Oh my God, external iliac. Which is the internal iliac actually? Again, now people are confusing with this. See, this is the body of uterus, external iliac or internal iliac. Top level of the uterus should go above external iliac. Ovaries drain para-aortic, uterine fundus drain along with the ovaries to para-aortic. Body of the uterus drains to the broad ligament to iliac group of lymph nodes. Now iliac, cervix drains to external iliac. Then uterine fold presacral lymph nodes. Young ladies sudden pain in the heel, unable to Achilles rupture, Simmons. There is weight beer, Achilles rupture, Simmons test. And what is Thompson? Thompson is not there. Simmons Thompson. Indication for renal replacement burns in therapy. Renal replacement in burn. Potassium is very high. Remember the vowels A, E, I, A, U. Acidosis, electrolytes, intoxication, right? Overload, uremia. Patients with diabetes present with oliguria, hematuria, and there is slough in the urine. Slough in the urine is papillary necrosis. Temporal bone fracture after high velocity present patient with otorrhea. Tegment tympani. Planned elective surgery in 8 weeks has anemia with 9. What is the best? Oral. 3% burn in the forearm with dry crusting and loss of sensation. Management post debridement. 3% post debridement. Split thickness. 26-year female has a 6-week history of unilateral breast pain. 8 out of 10 severity. Not related to menstrual cycle. What is the appropriate initial step? Reassurance. Okay. B, there is sonography, ultrasound is not given. A is reassurance, second is ultrasound. Acutely swollen knee arthrosis. What is the definite aspiration and send for culture sensitivity? Which is responsible for autolysis of pancreas? Amylase, trypsin, lipase, trypsin. Pancreatitis CT imaging shows diffuse fluid around the head. Pseudocyst, necrosis, body, tail, everywhere there is diffuse fluid. Limited fluid means can be necrosis. Patient has chronic pancreatitis on angiography, aneurysm, tortuous vessel, which diagrams electron. Which of the structures supply fundus on the stomach? Shortcut explaining management of the hypercalcemia, normal saline. Most risk preparing tibia with a saw, common appearance popliteal artery. Invert patient needs catheterization. Where should you first notice resistance membranous? These were around 67 questions.